Okay, it's broadcasting. I'm going to mute myself.
Hi guys, welcome to our webinar. We're just going to wait for a few people to join us. So we'll just sort of be sitting and waiting for a couple of minutes and then we'll get going with our presentation. Just give it another couple of minutes before we start. Okay guys, my name is Emma. I'm one of the midwives who works here at Complete Fertility, and my colleague is Jem, who is one of our specialist nurses. So we're going to be talking you through today about the support that you get from us here at the clinic in terms of the nursing team. I'm just going to share my screen with you so that you can see our presentation. We'll run through some slides. If at any point you've got any questions, there's a little Q&A kind of button at the bottom of the Zoom screen, so please feel free to write. Our clinic director, Julia, is on the call as well, so you should be able to see your questions as they come in and hopefully type replies, and as we go along, we'll try our best to answer any questions as well. So hopefully everyone can see our presentation here. So we'll get started.
Lovely. So as Emma said, I'm Jem. I'm one of the nurses as well. I just thought I'd just tell you a little bit about who we are as a company before we get started. So at Complete Fertility Centre, our goal is to optimise the chance of our patients achieving a healthy cycle-good pregnancy, and that is our overall goal. We do that by providing a high quality, evidence-based, individualised care. We're all very skilled nurses and as a team here, and I'll talk to you about that in a little bit more detail shortly. We're actually a member of Fertis Health, which is one of the leading fertility providers in Australia and Ireland, who are constantly growing. And we're also based within one of the leading teaching hospitals here as well, where we're always doing research programs which may or may not benefit you. We are also lucky enough to have opened some satellite clinics in other areas as well, such as Portsmouth and Bournemouth, so we can try and accommodate seeing more patients there.
So this is nice smiley pictures of all of our faces. So we currently have 8 members of the nursing team. A couple of the girls are on maternity leave, but Anne there, she is our nurse manager, so she's a very experienced fertility nurse who's leading us at the moment. And then there's myself, Emma, one of the midwives. I kind of joined Complete within the last year, and previous to that I was working on the delivery suite. So I'm kind of seeing things right at the very beginning now of conception, where my old job I was kind of right at the end of the journey. So it's really nice to see things from a different perspective. We've got Debs, she's one of our senior nurses, very experienced. Emily, we haven't got a picture, but she's actually a colleague who joined us from Vertus Health in Australia. So again, very experienced, and she's brought her expertise from kind of the other side of the world. We've got Sarah, who will be returning to us in February. Gemma, she's also background in midwifery. Been working at Complete for a couple of years now. Gem, she can tell you a little bit more about her background, and then Charlotte as well, who's just coming back from her own maternity leave.
Lovely, thank you, Emma. So yeah, I'm Gem. I've got a background in early pregnancy and sexual health. We've all got completely different backgrounds, all very relevant. The main one is obviously fertility, which involves gynecology, early pregnancy. As Emma said, we have midwives in our team as well. We have background in women's health. We are trained in ultrasound scanning as well, which we'll talk to you about that in a bit more detail, and also sexual health. So we've all got lots of relevant skills that we've brought together, and now have a nice team of skilled nurses for you. We all absolutely love our jobs. We find it very, very rewarding, and we are here to support you through this journey, which can be a roller coaster of emotions.
So I'm just going to go through this kind of flowchart here. So this is all the times that we can think of that when you will come in contact with meeting the nurse or one of the nursing team. So there's lots of points throughout your journey. So the first one is your initial nurse consultation. So this normally comes about after you've had consultation with the doctor. They've sort of said what treatment probably you're going to be suitable for, and that we're kind of just about ready to start. So at the moment, our nurse consultations are done mostly over the telephone and occasionally via Zoom. Obviously, that's in response to the current pandemic. Prior to that, we were meeting our patients face to face. So we've just had to kind of rework kind of the whole workings of the clinics and move a lot of things online, which was a bit of a change, but we're finding that actually things are working really well for our patients this way. We'll go through a little bit more about what happens at the nurse consultation a few slides down the line. The next time you'll kind of see the nurses, it will be a face-to-face visit, because we do need to do your screening bloods. So here we're going to take bloods from yourself, potentially from a partner if you're having treatment with a partner as well, and we're just screening basically for any bloodborne infections. All of our patients as well at the moment, before they start treatment, are needing to be screened for the COVID. So at the moment, that's a swab from down the back of the throat and up the nose. It's not very pleasant, but it's normally very quick, and it is essential to ensure the safety of not only you guys, but also us here at the clinic. After that, we've got all your results back, you've had your consultation and you're ready to go. You'll be seeing us for your ultrasound scans. So the scans are quite regular. We need to be seeing you sort of sometimes every other day. The scans are initially all internal scans using the tip of a vaginal probe, all done by the nursing team, so that we can just make sure that you're on track with your treatment basically, and your body's responding in the way that we need it to. Each time you come in for your scan, your next scan is booked for you, so you always know when you're coming back to see us, you know kind of what the next step is, and we always, if you've got any questions or anything at the scans, are able to go through bits and bobs with you as well, just to make sure that every step of the way you feel supported and you always know where you're headed next. And then we'll see you kind of on the biggest kind of procedure, I guess, of your treatment. So this is if you are, depending obviously what treatment you're having, if you are going down the route of IVF, you most likely will be having an egg collection. So that's a procedure that does involve a bit of sedation. So you come in that day, we do some checks, and we're on hand in the theatre assisting the doctor who will be doing the procedure, and then we'll be looking after you in the recovery bay as well. We just want to make sure that you're feeling really well and sort of okay after your sedation before we let you go, so you get really good care from us on that day. We also are trained, very skilled in doing intrauterine insemination. So for those same-sex relationships or potentially single women, using donor sperm or partner sperm, whatever method, we will be doing your insemination. That's a procedure which doesn't involve any sedation, but can be, again, just as daunting. So we're always on hand to look after you there as well. You'll see us again if you're coming back for your embryo transfer. We do have a couple of nurses that are able to perform the transfer themselves, but mainly these are carried out by our consultants. But we're on hand. We're normally present in the theatre with you to scan on your abdomen, which aids the doctors. Unfortunately, at the moment, because of the COVID, we can't facilitate partners coming through the clinic much at all unless they're having their own appointments. And so we are encouraging patients at the moment to kind of FaceTime or take pictures. We're printing off pictures and things to ensure your partner or family and friends are involved with that as well. And then you'll see us again kind of close to the end of your journey, I guess, with us in the fertility clinic. Fingers crossed, if we've achieved a pregnancy, you see us at 7 weeks, which is a little bit earlier than if you had a natural conception and you were having your NHS scan. You get one at 7 weeks, so that hopefully at that point we can give you some good news. And that's one of the nicest part of our job, sort of, you know, seeing patients all the way through and then being able to give them the good news of an ongoing viable pregnancy at the end of everything.
So as nurses at the clinic, we are kind of your main point of contact. You'll have a lot of contact with us throughout your journey. Main contact is courtesy calls. So we are offering courtesy calls during multiple times during the journey. This includes after a transfer, before any pregnancy tests. We're always here to answer the clinical inquiries as well. You're always going to have a lot of questions about your journey, and that's absolutely fine. We are obviously clinical as well, so we will be doing clinical things during the morning, but we are always there, if not in the morning, but in the afternoon, to answer any questions you have. We are the ones that pick up your pregnancy test results as well, so we're always available to talk to you about these, and if they are positive, we also get you booked in for the HCG blood test, which just confirms everything, and then hopefully arranging the pregnancy scans that Emma has just spoken about. We also have an emergency phone that one of us nurses take home every day. So if it's an emergency and the clinic is not open, you know that you've always got someone there that you can talk to if you need to. There's someone there all of the time. We've also got a new patient Facebook support group, which is, we've heard so many positive things about. We will go into that in a little bit more detail shortly. And it's run by one of our nurses and the counsellor. We've also got a buddy system, which once again, we will talk to you in a bit more detail about shortly. And just to sum it up, we are always there to provide individualised care and support. Everyone is different. Everybody's journey is going to be different, even if you're on the same treatment plan or not. It's going to be different for each person, and we try and personalise and individualise that care because everybody needs slightly different care.
So here's some other friendly faces that you may well see working alongside us in the clinic as well. So these are our lovely healthcare assistants. So they are sort of about in the clinic day to day. They're assisting with blood taking, swabbing for the COVID. They're on hand in the theatre. They keep us in line, really make sure that the clinic's running in a really nice, smooth, streamlined way. They're a really good source of support as well. So you may well come into contact with the HCAs as well as us as well. So this slide here is going to go into a bit more detail about what happens at your initial nurse's consultation. So this is the first contact that we'll have with you, and like I said, they are now mostly over the telephone, just because we can't facilitate lots of people coming through the clinic still at the moment. They're working really well. So generally what will happen is once we know your appointment is booked, your consultation is kind of allocated to each of us. We might do sort of 1-2 consults a day. We'll normally in the morning look at who's coming into the clinic, and then aim to make contact with you initially over the phone so that we can either confirm an email address or send you out some documents that you can have a read through, and then potentially send you out a Zoom link as well. When we're on the phone during the consultation, it's normally an appointment which lasts about an hour, and generally it's just more like a chit chat. So normally we'll go through, make sure that if you've got any questions initially, we'll answer those. We'll talk through your individual treatment regime, so depending kind of on what the doctor thinks is most suitable for you, you'll be put on one of our regimes, and then you'll be prescribed a medication that's tailored to you as well, depending on things like age, previous history, kind of some of your blood results. All of that will be looked at, and we'll pop you on the regime that's suitable for you. We'll run through that so you know kind of what to expect during the treatment. We'll send you out some links to some videos which instruct you on how to use your medication. So this could be one of the most daunting things I think people coming through IVF face. You know, most of us aren't okay with having to inject ourselves, unless you're sort of, you know, in healthcare. So this is what lots of people worry about. But to be honest, we'll run through it with you. It's not as scary as it seems. It is quite straightforward. You can't go too far wrong with it. And we always say, you know, if you are stressed or worried about it, we're always at the end of the phone. We're happy to run through the medications with you again if you need to. So we'd never want anyone to worry or get worked up about that. We'll go through your prescription with you. So our medications are delivered directly from our drug company that we use. We don't give them out from the clinic ourselves. So we'll make sure that we're happy that we've got your correct details, that you're not allergic to anything, and we'll let you know what medications you should be expecting to be delivered as well. We'll go through a little bit about kind of preconception and how we can support you in optimizing your diet and lifestyle to ensure that we hopefully get the best result that we can from treatment. So that will go through things about your background, maybe about smoking, making sure that your diet is balanced, talking to you about exercise, and then making recommendations for any sort of additional vitamins, folic acid and things like that. A big part of the nurse's consultation is making sure that your consent forms are all filled in correctly and free of errors, basically. So before you have your nurse's consultation, you'll be sent logins to an online platform which gives you lots of information and then asks you for your consent basically to treatment. It's really important because these are legal forms, that everything is filled out correctly. So we'll spend some time going through those, making sure that you understand kind of what you signed, and if there are any errors, then we can talk you through those and correct them. We'll go through, if you're coming through as a private patient and you're paying for your treatment, then obviously we need to talk to you about your costs, what's involved, so that you know right from the get-go kind of what costs are involved, and go through the T's and C's about kind of how we expect payment and things, so that you're not sort of stressed about that. We'll talk to you about kind of current infection risk. So obviously previously we had the Zika, that's a virus that is found in mosquitoes in certain countries. Not many people are traveling so much at the moment, so that kind of it's still really important that people are educated about it. So we'll talk to you about that, and obviously at the moment the current pandemic situation, so we've had to make lots of adjustments to work safely within the clinic. So COVID-19 is very important, so we just run through our current guidance and recommendations to make sure that you guys are safe and that you're happy to proceed with treatment, and we'll get you booked in for some COVID swabs if you require them as well. If you're entitled to NHS funding, we'll go through that. We'll make sure that you know what you're entitled to, what CCG area you're in, make sure that it's valid, and you know when it's due to expire. We'll book any appointments for you at this nurse consultation that you may need. So the big ones are your screening blood tests. We'll book you for a COVID test, and some people may require additional screening before they start their treatment, such as ultrasound scans, practice runs of transfers and things like that. So we really carefully go through your background. We look at what the doctors have written so that we can make sure that your care is kind of tailored to you. And then finally we'll talk to you about when your period is due so that we can get an anticipated start date. We'll run through a rough timeline of kind of dates so you know when you can expect what will happen. The nature of fertility is quite changeable. It's not black and white in terms of when your appointments are going to be, because we're working with menstrual cycles, and as women we know that they're sort of you can never count on them to come, particularly when we want one. It may be late or whatnot, so we'll give you a rough estimate so that you know where you're at, what you're expecting, and that's also quite helpful in terms of talking to employers about maybe the time off that you're going to need as well.
The nurses are always there to do your ultrasound scans as well, okay? I just want to mention that we've also got a sonographer called Lucy who works alongside us. She's not a nurse, but she's completely trained in doing these scans, so she's an ultrasound expert. Most of you may see Lucy before you start treatment. She does a scan just to make sure that everything is looking nice and normal before you start your treatment with us. You then have your baseline scan, which is the first scan that you have with the nurses before you start your treatment. We are requiring everybody to have the COVID swab within 7 days of this baseline scan. Lots of people are very worried about the scan, but they find that once they've actually had it, it's not as bad as it seems. People can get very worked up. We want you to not worry about these scans, okay? Your first scan, so your baseline scan, will be on day 1, day 2, or day 3 of your cycle as well, which a lot of people can also be very worried about. But we do multiple scans every day. We spend all of our morning scanning, and we are totally used to this and want you to feel as comfortable as you can while we're doing these scans, okay? At your baseline scan, we will be measuring your womb lining and also counting how many follicles you have on your ovaries, because it's those follicles that we're going to be getting to grow with your medication and will hopefully then contain an egg. Once we've done the scan, we will liaise with the doctors who will tell us what dose of medication they would like you to be on. Each patient will be on a different dose because everybody is different, and the doctor will have a look through your history and will then confirm what dose of medication they want you to start. After your baseline scans and after you've started your medication, you'll then have your tracking scans. These tracking scans will go on for about 12 days because that's how long it takes for you to become ready for an egg collection or an insemination. If you're having a frozen embryo cycle, then it may be slightly longer. But once again, each person is different. Some people will respond a lot quicker, some people will need a little bit more time, and that's absolutely fine. The tracking scans will be every other day for about the 12 days. And at those scans, we're just going to be checking that your womb lining is becoming thick and to make sure that the follicles on your ovaries are also growing. After around 12 days, we will then be able to confirm when you are ready to have either your egg collection or insemination, or ready to have your frozen embryo transfer booked. And we will then confirm that one final injection called the trigger injection, which basically tells your body that you are then ready to have this procedure. After the long journey, you will hopefully then have your pregnancy scan, which the nurses do as well. It's the best part of my job. That's around 7 weeks, as Emma said earlier on. At that scan, we should be able to confirm a heartbeat as well. So it's a really, really nice time for everybody.
So here's a little slide just telling you a bit more about the Facebook support group. So obviously we are here in the clinic normally every weekday 8 till 4, but obviously there are some points where you can't physically sort of maybe get through to a nurse there and then. So the Facebook groups are a really good form of support outside of the clinic. So to join it, it's a closed group, so you need to search for it on Facebook, and we need to confirm that you're patient with us before we kind of allow you access. We just ask you a couple of questions to confirm that, and then it's run by one of our counsellors, one of our nurses. They sort of moderate it. They post various different points for discussion, kind of ask you about your experiences, and then everyone can kind of chip in and post what they sort of are going through, I guess. So there'll be lots of people in a similar situation to yourselves, where you can all kind of share experiences and help one another through. Sometimes it's really nice to have someone who's also going through what you're going through to be able to relate to other patients in sort of similar circumstances. So we would encourage any of our patients to join this if they want to.
So we keep talking about the counsellors. The main counsellor we have in the clinic is Judy. Counselling is encouraged a lot during treatment because it can be such a stressful time for some people. It's confidential. You can have it as a couple, or if you could have it individually if you're coming through on your own, or if you want it individually, then that's absolutely fine as well. You actually get up to 6 sessions included in your package. If you are receiving or donating gametes, then it is routine that you have counselling, just so you understand the implications. Benefits of counselling are that it can help you decide on the best course of action for you. Once again, I keep saying that everyone is different. It can help with dealing with stress and anxiety, coping with family and social situations. Fertility is not something that is discussed very often, and some people do struggle with talking about it within the family, so counselling can help with that as well. Also there to support following bad news. As I keep saying, it is a roller coaster, so you'll have the positives and the negatives, and we want to be able to support you through the whole journey. So we have the counsellor there available as well if you needed to book in. Counselling sessions are being done over the telephone as well, which some people are finding it easier because with work it can be very difficult fitting in all of these appointments, and it can be easier if it is over the telephone.
So another resource available to our patients is our little app that can be downloaded onto your smartphone. So this it's called MediEmo, and basically you can download it, you create a registration for yourself. It's linked to us here at Complete. And once you're confirmed that you're ready to begin your treatment, and we've confirmed a dose with the doctors, then we activate it with your regime. So we pop on what medication you're on, your dosage, and it will ping up with notifications, normally morning time, to remind you to kind of take your drugs. The fertility treatment can be really overwhelming. There's lots going on, really emotional as well. So this kind of just helps you remember, and is quite useful. You don't obviously have to use it. There's also another side of it, which is the emotional side of it and your mood management. So every so often it will come up with a little chart, ask you a few questions, and sort of put in how you're feeling. Depending on what you choose, it then can signpost you to various different resources, coping methods, and bits and bobs to help you through your journey, I guess. So if there's anything ever that you're worried about or confused about, the app might prompt you to think that you're feeling that way, and if it is something that you're really struggling with or want to have a chat about, then we would always encourage you to call us in the clinic. We'd rather you called, even if it's something you felt was small or insignificant, but if it's worrying you, we're always at the end of the phone. Like I said, if we're not physically at our desks, we may be away doing clinical bits and bobs, we would encourage you to leave a voicemail, and we always try and get back to you by the time we leave the clinic on a weekday. When we're doing our consultations at the moment, we send out emails. Most of you will then have an email to at least one of the nurses in the clinic. Again, we would encourage you to, if you're struggling to get hold of anyone, to send us an email. Obviously nothing urgent, because we work on a 4-day rotation, so there's normally a day when we're not physically in the clinic. But for any sort of little queries or just to check in, ping us an email, and you'll normally get quite a quick response. If we're not at our desk, then we also can signpost you to the admin team, who again work really closely alongside us, and are also a really good form of kind of patient support as well. They know the referral system from GPs inside and out, and we know sometimes that getting referred through via a GP is not always straightforward and simple, so they are our experts, in that sort of respect as well. So if there's a question we can't answer, there's always someone in the office or someone in our team that can answer that and support you in that way as well.
So as I mentioned earlier, we have the Buddy programme here at Complete. So the Buddy programme is run by one of our nurses, and it involves matching you with someone who is in a similar situation to yourselves. So with the Buddy programme, once we have matched you with somebody, we let you agree kind of peer-to-peer support on your own terms. So we do the introducing, and then we give you contacts of one another through your choice of contacts. For some people, this might be email, it could be telephone. And then we let you go off on your own terms. So it's not us overseeing it. You can choose how you want to contact each other and what you want to contact each other about. If you do want any more information about this, then we have our patient support email address on the screen. That patient support email address can also be used for other things. If you are requiring any extra support, and you know, counselling isn't for everybody. If you just needed to talk to somebody and you wanted it quite informal, or if it's just easier for you to email than actually talking to somebody, then that email address it can be very, very useful for some people. It does require a lot of attention going through the fertility treatment. As I mentioned earlier, it's not always easy to fit it in with your day-to-day lives because of work commitments or other commitments. So some people do find it easier just to send us an email, and that's absolutely fine. The nurses also have an email address for all of us, and that's nursing@completefertility.co.uk. We do welcome emails if you have any questions about anything.
So this is just some nice feedback from the HFEA. So they are our licensing body. They're the ones who come and do sort of regular inspections to make sure that the clinic's running to a really high standard and providing really good care. So it's always nice to hear positive feedback and that we're being recognised as doing a good job for staff and for patients. So you guys can just have a little read of kind of what they've said about us in our last inspection. If you want any more information specifically about Complete in terms of stats or treatment outcomes and things, you can go onto the HFEA website. They are again a really good resource in terms of kind of finding out a bit more background about the clinic itself, and obviously we have our Complete Fertility, our own website as well, for you guys to have a little look at as well.
Here is some feedback about what some of our patients say. I'm not going to read it all out to you, I'll let you read that. But it's just nice to see that we have helped and supported people through the IVF journey. And we're more than happy to, we really enjoy it.
Perfect. So that's kind of the end of our presentation. We would welcome any questions if there's anything that we haven't explained clearly there, or anything that's kind of stirred up some questions. Please just use the little Q&A thing at the bottom of the screen there. We're happy just to sit and chat for a little bit longer if anyone's got any questions. But we hope that that was really useful. As I said, I'm kind of fairly new to working here at Complete. I've been here just nearly a year, but I've found that sort of working here, I'm always really well supported. It's a lovely place to work, and because I'm happy in my job, I feel like I can really do a good job day to day in supporting you guys. Meeting patients face to face is obviously, patients are the best part of the job, and being able to give good care and get good outcomes is really good. Have a little look.
I'll just add that to that as well. Mute your microphone a second. So we all get on really well as a team. We are all similar personalities. We all get on really well, and we all enjoy working together inside and outside of work. We are all friends. We are very happy, and we all get along really well. It's a really nice place to work, and we want you to feel welcome in our clinic as well.
I'm just going to answer one of the questions that's come through. I'll read it out loud so that it might be useful for other people as well. So someone's asked, do we get the clinic code for the Medi-Emo app at the nurse consultation? Yes, you do. We've got some little cards printed out for the clinic code. So once you've come for your consultation, you've told us that you've downloaded it and you're ready to go, we'll give you that code so that you can sort of register. And then I'll just answer the one above that, and then I'll let Jem do a couple. It's saying, someone's asking, how likely is it that my husband can attend the clinic with me for the transfer? So this has been one part of the job that's been really difficult for us, because traditionally we've always, you know, involved families and partners and, you know, treating everyone as a whole. Oh, I'm just getting live updates just now. So at the moment, it is currently a no, and that's for most of the appointments for the clinic. It's just you know, for those that are having treatment. However, I know that obviously restrictions nationwide are being loosened, and the trust within which, you know, the hospital that we sit in are looking at kind of changing attendance for scans. So for important appointments, so transfers and obviously the scans as well, we know that it's not ideal not having your partner present or not having a support person present. So we're hoping in the near future that we're going to be able to update that and let partners be present for transfer and the 7-week scan. So that's some good news.
So one of the other questions, how long is it normally between initial nurse consultation and egg collection? So once you have had the nurse consultation, we find out dates of when periods are due to arrive and when obviously you want to start treatment as well. We always aim to get you through with your next period. We obviously need a bit of time to get a COVID sort of arranged, a bit of time to order the medications as well, because as Emma said, they get delivered to your house. So ideally, we would like to get you started with your treatment with the next period following the nurse consultation. But if it's quite close, then we would just push it back to the next month. So once you've had the nurse consultation, the wait for actually starting the journey is not that long, and as I said, it takes about 12 days worth of medication to get you to the point of the egg collection.
So there's a couple of questions that I'll just address that have come through that are sort of quite clinically based, and unfortunately I don't think we're kind of in the position to answer those just at the moment. It's kind of more sort of patient information, so I'm sorry, we're probably not the best people to answer those couple of questions there, but there is another one here that's asking again about initial consultations. I'm not sure if that means a doctor or nurse, but either way, how long does it take for NHS funding to come through? Again, not the expert in the funding, but we do have a very lovely funding lady who works alongside us very closely, who does know lots of the ins and outs of it. At the moment, I think we're finding that the funding is actually being approved fairly quickly. Everything's normally kind of, there's lots of forms to fill out initially, but then things go off and they're getting approval within sort of a few weeks. And then normally as soon as we hear anything from funding, our funding lady straight on the phone to give you an update. And after your funding has been approved, we aim to get you through with your appointments as soon as kind of their spaces.
So another question, what is the best lifestyle change to improve IVF chances? So some of the main things that we talk about quite often is healthy lifestyle in general. So smoking, we would recommend against smoking, not just for IVF, but in general. Diet as well, a well-balanced, healthy diet, keeping the BMI within limits as well. Alcohol, we would advise against alcohol during fertility treatment and leading up to it. And once again, with caffeine, we would just recommend keeping caffeine to the minimum, having 1 cup a day if you can. Just kind of following, we would say following the kind of early pregnancy advice, same advice for fertility treatment.
Perfect. So I think we've answered there all the questions that were waiting in our little inbox. I don't know if anyone else has anything else before we sort of end the webinar. But if you do think of anything afterwards, there are emails on our website that you can send general inquiries. Or obviously we would encourage you guys to come through and make appointments if you're kind of in the right place and if that's where you're at. Obviously we're excited to meet more future patients. So thank you for joining us. We hope it was useful, and we, potentially will be seeing lots of you very soon. Thank you very much. Bye.